Hello everybody and welcome to my channel. This is Dr. Mridula V. Amarnath here. So today I am going to talk to you about a very important topic about deworming your baby. So today we'll be discussing about what exactly is deworming, now how do kids get these worms, and what are the symptoms that as a parent or a caretaker we need to look for, how often do we need to deworm our little one, and what are the different ways that we can prevent it. So stay tuned to know more. So there are a lot of intestinal worms like tapeworm, pinworm, roundworm. Now these worms, they enter into the human body and then they mainly start affecting the intestines of the human body. So now once they start affecting that, it can cause a lot of health issues to your baby. So now this could have happened either because of unhygienic conditions or consumption of food or water that is contaminated. So it is important that we first try and identify the type of worm that has been infested into your baby's body and try and consume medications that will help us to expel these worms from the baby's body. So this process of expelling the worms from your child's body using adequate medications is called as deworming. So I'm going to discuss with you some of the most common causes from where kids can actually acquire these worms. Water is the most common medium of getting an infection. So drinking contaminated water can certainly invite infestation of worms in your kids. Another thing is consumption of undercooked meat from an infected animal or undercooked fruits and vegetables infected with worms. Now we know kids spend quite a lot of time playing with the soil. So soil infested with worms is another culprit behind causing an infestation in your kid. And the most important thing is hygiene. Now, if there is poor hygiene, it is a very common and easy way for these worms to travel into your baby's body. Having infected pets can also become the messenger of parasitic worms that can easily travel from your pets to your kid. Lack of sanitization is another important cause of parasitic worms, especially for those who do not have this habit of washing their hands after using the toilet. Now these parasitic worms or these intestinal worms, they breed in these unhygienic conditions. So now when your little one touches on things which are not clean or toys or which are not clean, what happens is these eggs come and settle on their fingers. And most of these kids, they tend to have this habit of putting their fingers onto their mouth. So in this way, naturally the eggs travel into the baby's body and infest in the intestines and thereby cause a lot of issues. So now as a parent, it is important that we pick up these little symptoms and try and treat them as early as possible. So some of the most common symptoms that you see are abdominal pain, redness or rash on the buttocks, vomiting or diarrhea, loss of weight, loss of appetite, anemia that can be related to parasitic worms. Then they tend to have extreme tiredness, weakness or hunger due to worms. Some of them may also have blood in their stools, diarrhea or constipation, urinating frequently or even pain while urinating. So generally kids who have a very low immunity are more susceptible to the infestations caused by these intestinal worms. So now we should be extremely careful for some of the most common complications, long-term complications caused by these worms such as malnutrition, intestinal blockage, a hindrance to the healthy growth of the children, weight loss and even anemia. So now how do we prevent it? So like they always say, prevention is always better than starting the kids on treatment. And especially when it comes to our little ones, we do not really want to start them on oral medications or syrups at a very young age. So I'm going to share with you some simple tips which it is important that you follow them on a regular basis. So make sure that your kids wash their hands properly with soap before consuming anything. Wash fruits or vegetables properly before eating. Prevent your kid from playing barefoot in mud, sand, grass or any other outdoor places. Now prevent your kid from eating meat, especially pork and fish which is uncooked. Make sure that any swimming pool your child visits is in line with the hygienic standards. Avoid drinking water from public places always make sure that your little one drinks purified water. Now we all know, in spite of taking so much of precaution and so much of extra care and boiling everything before giving to our child, there are certain circumstances which is not under our control. So it is always better to make sure that you deworm your baby. So according to the WHO, it says that you will have to start deworming your child starting from 6 months of age till 5 years of age every 6 months. Okay, now this deworm medication is a syrup and it is a very mild syrup, and generally most kids can tolerate it very well. Maybe a few of them might have a little tummy pain, nausea or a headache, but otherwise most of them tolerate it very well. So as a parent or a caretaker, it is important that we make sure we deworm our little baby very frequently, like I said, at an interval of 6 months, because it is important for their healthy growth and nutritional requirements very early on in their life. Like I keep saying, till their baby is 5 years of age, their health, their mental growth, physical growth is extremely crucial and important. So think about it and stay safe. Bye-bye.